Klüver-Bucy Syndrome, a mind out of control. Imagine waking up one day and the world feels different, not in a subtle way, but completely unrecognizable. The people around you look familiar, but you don't feel anything toward them. Faces are just shapes, emotions don't register, and fear, one of the most basic human instincts, is completely absent. You walk through life unfazed by danger, disconnected from consequences, and worst of all, you're doing things that don't make any sense. You start putting random objects in your mouth, your phone, a spoon, even the corner of a book. You can't stop yourself. You feel a strange compulsion to explore everything by taste. At the same time, your body betrays you in another way. You become overwhelmingly, uncontrollably sexual, not just in private, but in ways that make people around you uncomfortable. You don't understand why your behavior is changing, but it's as if an unseen force has taken control of your mind. This is Klüver-Bucy Syndrome, a rare and bizarre neurological disorder that hijacks the brain in ways that seem almost fictional. First discovered in the 1930s by two researchers studying monkeys, this syndrome is caused by severe damage to the temporal lobes, particularly the amygdala, the part of the brain that controls emotions, fear, and social behavior. When this region is destroyed, the results are terrifying. Most people with Klüver-Bucy syndrome don't just lose control, they lose a fundamental part of what makes them human. They can't recognize emotional expressions, can't feel fear, and often act in ways that are childlike, reckless, or inappropriate. Someone with this disorder might walk straight into oncoming traffic without hesitation because their brain no longer processes danger the way it should. But how does a person develop this condition? Unlike other brain disorders that are genetic or slowly progressive, Klüver-Bucy syndrome happens when the brain is damaged suddenly. The most common cause? A devastating brain infection called herpes simplex encephalitis. This infection attacks the brain and destroys the regions responsible for memory, emotion, and self-control. But that's not the only cause. Severe head injuries, strokes, brain tumors, and even degenerative diseases like Alzheimer's can also trigger the syndrome. Living with Klüver-Bucy syndrome is not just challenging, it's dangerous. Many patients require constant supervision because they're at risk of hurting themselves or others. Imagine someone who can't recognize danger, who compulsively puts things in their mouth, even sharp objects or poisonous substances. Or someone who suddenly exhibits inappropriate sexual behavior in public, not because they want to, but because their brain no longer knows what's socially acceptable. There is no cure. Doctors can only manage symptoms, often using medications that calm impulsive behaviors, such as antipsychotics or mood stabilizers. Therapy can help patients relearn social behavior, but the damage is often permanent. Some recover partially over time, but others remain trapped in a reality where their emotions, impulses, and basic instincts are completely out of sync with the world around them. Klüver-Bucy syndrome is rare, but for those who experience it, life becomes an unsettling, surreal experience, one where the most basic human functions are stripped away, leaving only raw, uncontrolled impulses. Capgras Syndrome. When loved ones become strangers. Imagine looking at your mother, your father, your spouse, or your best friend, and feeling absolutely convinced that they are not who they claim to be. They look the same, they sound the same, they even have the same memories, but something deep inside you knows they are an impostor. You argue with them, you demand the truth, you might even fear them, convinced that the real person has been replaced by a perfect double. This is Capgras Syndrome, one of the strangest and most unsettling cognitive disorders ever recorded. Unlike paranoia or schizophrenia, this disorder doesn't make people see things that aren't there. It makes them believe that the people around them have been swapped out, as if reality itself has been altered. For the person experiencing it, the world becomes a thriller movie where the closest people in their life are suddenly untrustworthy. Some patients even believe that objects have been replaced, that their house is a copy, that their pet is a replica, or that their city isn't real. It's a terrifying, isolating experience that disconnects them from reality in a way few other disorders do. But how does this happen? Capgras syndrome is thought to be caused by a disconnect between two crucial parts of the brain: the fusiform gyrus, which helps recognize faces, and the limbic system, which is responsible for emotional responses. Normally, when you see someone you love, your brain not only recognizes their face, but also triggers an automatic emotional response: warmth, familiarity, safety. But in Capgras syndrome, that connection is broken. The person can still recognize faces, but they don't feel anything when they look at them. The brain interprets this as a trick, as if the person they know has been replaced by a convincing impostor. This bizarre condition is most commonly seen in people with schizophrenia, brain injuries, dementia, or neurodegenerative diseases like Alzheimer's. Sometimes it appears after a severe trauma, especially if the brain has suffered damage that affects memory or perception. For families, dealing with someone who has Capgras syndrome is heartbreaking. Imagine a husband who wakes up one morning and accuses his wife of being a stranger pretending to be his real wife. He refuses to be near her, he becomes paranoid, and no amount of reasoning can convince him otherwise. Logic doesn't work, because to him this isn't a delusion, it's an absolute, unshakable truth. Some patients become aggressive, believing they need to escape or defend themselves from these impostors. Others withdraw completely, unable to trust anyone. And because this disorder often appears alongside schizophrenia or dementia, it can worsen over time if not treated. There is no guaranteed cure. Doctors usually rely on antipsychotic medications, cognitive therapy, and in some cases, sedatives to manage symptoms. In some instances, treating the underlying cause, whether it's a brain injury or a degenerative disease, can help lessen the severity of the delusion. But for many, the world remains a confusing, unsettling place where the people they love are forever strangers. Capgras syndrome is not just a disorder, it's a nightmare of perception where the brain's most fundamental ability to recognize familiarity is shattered, leaving the person adrift in a reality they can no longer trust. Cotard's delusion, the walking corpse syndrome. Imagine waking up one day and feeling completely certain that you are dead. Not metaphorically, not as an exaggeration, you genuinely believe that your body has decayed, that your organs have rotted away, or that you simply no longer exist. You stop eating because, after all, why would a corpse need food? You stop taking care of yourself because hygiene is pointless when you're already decomposing. You walk through life as if you are a ghost, convinced that you are no longer part of the living world. This is the horrifying reality of Cotard's delusion, also known as walking corpse syndrome, one of the rarest and most disturbing cognitive disorders ever recorded. Named after Jules Cotard, the French neurologist who first described it in the late 1800s, this condition turns the sufferer's own sense of existence into a nightmare. Unlike depression, where a person may feel hopeless or disconnected, Cotard's delusion completely erases the sense of being alive. Some patients insist that they have lost their blood, their organs, or even their soul. Others believe they are trapped in some kind of purgatory, cursed to wander the earth without a body. In extreme cases, people stop moving, stop talking, and even refuse medical help, because why would a corpse need a doctor? The root of Cotard's delusion lies in severe disruptions within the brain's temporal and parietal lobes, regions responsible for self-awareness and emotional processing. In normal brains, these areas help us form a clear sense of "I exist," giving us a connection to our body and surroundings. But in Cotard's, this process is severed, leading to a complete detachment from reality. This disorder doesn't appear out of nowhere. It is most commonly seen in people suffering from severe depression, schizophrenia, brain tumors, epilepsy, or neurodegenerative diseases. Sometimes it follows a traumatic brain injury, as if the brain, faced with extreme damage, tries to explain its confusion by convincing itself that it is already dead. One of the most famous cases involved a Scottish man named Graham. After surviving a suicide attempt, he became convinced that his brain had stopped working and that he was dead. He stopped eating, withdrew from the world, and even insisted on visiting a graveyard because he felt it was the only place where he truly belonged. When doctors performed a brain scan, they discovered something shocking. His brain activity was eerily similar to that of a person in a coma, as if parts of his mind had literally shut down. For families living with someone suffering from Cotard's delusion is terrifying. Imagine a loved one telling you with absolute certainty that they are dead and that you are mistaken in thinking otherwise. No amount of reasoning works because to them, their death is a fact. Some even become suicidal, not because they want to die, but because they believe they have already died and must complete the process. Treating Cotard's delusion is incredibly difficult. Traditional psychiatric medications like antidepressants, antipsychotics, and mood stabilizers can help, but in extreme cases, electroconvulsive therapy, ECT, has been one of the most effective treatments. This controversial method, which involves passing small electrical currents through the brain, has actually helped some patients wake up from their delusion, reconnecting them with reality. But even when treated, the scars of Cotard's remain. Many survivors describe the experience as the most horrifying thing a human mind can endure, a state where the most basic truth, the fact of being alive, is stripped away, leaving only an empty, disconnected existence. Cotard's delusion is not just a disorder. It is a horrific existential trap, a rare and devastating condition that takes away the one thing we rely on every day, our certainty that we are real, alive, and part of the world. Alien hand syndrome. When your own hand betrays you, imagine sitting in a quiet room, doing absolutely nothing, when suddenly your own hand starts moving on its own. It reaches out, grabs objects without your control, or even slaps you in the face. You try to stop it, but it fights back, resisting your commands as if it belongs to someone else. It moves with purpose, yet you have no idea why it's doing what it's doing. It's not numb, it's not paralyzed. It just won't listen to you. This is the terrifying reality of alien hand syndrome, a rare neurological disorder where a person's own limb, most often a hand, acts independently, as if possessed by an unseen force. The affected person has no control over its movements, and in some cases they even feel like the limb doesn't belong to them at all. It can grab objects, destroy things, button or unbutton clothing, and even fight against the person's other hand. Unlike normal involuntary muscle movements like a twitch or spasm, alien hand syndrome produces purposeful, intentional actions, as if the hand has a mind of its own. Some people describe it as a living, separate entity, an evil twin that refuses to obey commands. But what causes this bizarre condition? Alien hand syndrome happens when there is severe damage to the brain's motor and sensory pathways, usually due to a stroke, brain injury, tumor, or neurodegenerative disease. It is most commonly seen in people who have undergone split brain surgery, a procedure where doctors sever the connection between the brain's left and right hemispheres to treat severe epilepsy. Normally, these two halves work together, but when they are disconnected, the left hand, controlled by the right hemisphere, can start behaving on its own. There are different forms of alien hand syndrome, depending on which part of the brain is affected. If the frontal lobe is damaged, the affected hand may show aggressive, forceful movements, grabbing things, pulling on clothes, or even hitting the person's own body. If the parietal lobe is involved, the person may lose the sense of ownership over the hand, feeling as if it's completely separate from them. If the damage is in the corpus callosum, the bridge that connects the two brain hemispheres. The hands may even start fighting each other, with one undoing the actions of the other. A person may button their shirt with one hand, only for the other hand to immediately unbutton it. For those experiencing alien hand syndrome, daily life becomes a constant battle against their own body. Imagine trying to pour yourself a drink, only for your rogue hand to suddenly slap the glass away. Some patients even tie down their uncontrollable limb to prevent it from interfering with their tasks. Others become deeply paranoid, convinced that something supernatural is controlling them. There is no cure for alien hand syndrome. Treatment focuses on managing symptoms, using methods like behavioral therapy, sensory reconditioning, and sometimes even Botox injections to reduce involuntary movements. Some patients train themselves to distract the rogue hand by giving it an object to hold, like a ball or a pen, keeping it occupied so it doesn't act out. But despite therapy, the feeling of not being in control of one's own body remains deeply unsettling. The idea that a part of you, something that should be completely under your command, can rebel, resist, and move against your will is one of the most terrifying realities a human being can experience. Alien hand syndrome isn't just a disorder. It's a neurological nightmare, one where the battle isn't with an external force but with your own body, your own mind, your own self. Prosopagnosia, the face blindness, nightmare. Imagine walking into your home and seeing a group of people sitting in your living room. You recognize their voices, their clothes, and the way they move. But their faces? They're completely unrecognizable, as if you're looking at strangers. You try to focus, to make sense of their expressions, but it's like staring at a blank canvas. Then, someone speaks, and it clicks. It's your mother. You just didn't know it until she talked. A second later, your best friend reaches out to shake your hand, but once again, their face means nothing to you. This is what life is like for someone with prosopagnosia, also known as face blindness, a rare neurological condition that makes it nearly impossible to recognize faces, even of the people closest to you. For some, it's mild. Faces look unfamiliar but still vaguely recognizable. For others, it's so severe that they can't even recognize their own reflection in the mirror. Prosopagnosia isn't a problem with vision. The eyes work fine. The brain, however, fails to process facial features as a whole, meaning that every person looks like a random collection of eyes, noses, and mouths rather than a recognizable individual. This condition is caused by damage to a specific part of the brain called the fusiform gyrus, which is responsible for facial recognition. It can be acquired, usually from a stroke, brain injury, or degenerative disease, or congenital, meaning a person is born with it. Some people never realize they have it because they've spent their whole life using other cues to recognize people, like hairstyles, voices, clothing, or even the way someone walks. The effects of prosopagnosia go far beyond simple forgetfulness. Imagine walking past your spouse on the street without recognizing them. Imagine picking up your child from school and being unable to tell which one is yours. Imagine looking at a group of coworkers and being completely lost, unable to tell who you've known for years and who's a total stranger. Social life becomes a constant guessing game. People with prosopagnosia often rely on context, waiting for someone to speak, checking what clothes they're wearing, or looking at distinctive features like scars or glasses. But if a familiar person changes their hairstyle or wears something different, they might as well be a stranger. For those with severe prosopagnosia, even recognizing movie characters is impossible. Many avoid films and television because they lose track of who's who the moment the scene changes. It's like watching a movie where every character swaps faces randomly. The psychological effects of face blindness are devastating. Many people with the condition experience anxiety, depression, and social withdrawal because they fear being seen as rude, cold, or distant when they fail to recognize friends and family. Some even avoid social gatherings altogether, too embarrassed to admit they can't recognize the people they love. There is no cure. The brain damage that causes prosopagnosia is permanent. However, some people can train themselves to use other methods of recognition, like memorizing someone's voice or focusing on specific details about them. But no matter how much they adapt, the world remains a confusing place, filled with familiar strangers, where every greeting, every introduction, and every encounter is a puzzle they will never truly solve. Prosopagnosia isn't just forgetfulness. It's a disconnect from human recognition itself, a condition that erases one of the most fundamental aspects of human connection: the ability to see a face and know who it belongs to. Fatal familial insomnia, the disease that steals sleep and life. Imagine lying in bed, exhausted beyond belief. But no matter how long you keep your eyes closed, sleep never comes. Not just for one night, not just for a week, but permanently. Your body is drained, your mind is slipping, and every attempt to rest is like running toward a door that's forever locked. At first, it feels like a strange case of insomnia. But then, things get worse. Your memory starts to fail, your thoughts become jumbled, and simple conversations feel like climbing a mountain. You begin to hallucinate, seeing things that aren't there. Your heart races, your body shakes, and soon, you can't even stand up properly. As the weeks go by, your mind deteriorates completely, and then you die. This is fatal familial insomnia, FFI, a 100% fatal brain disease that slowly, mercilessly destroys the ability to sleep until the body and mind completely break down. There is no cure, no treatment, and no way to stop it. Once the symptoms begin, death is usually inevitable within a year or two. FFI is caused by a genetic mutation in the PRNP gene, which leads to the buildup of misfolded prion proteins in the brain. These toxic proteins destroy neurons in a part of the brain called the thalamus, which is responsible for controlling sleep, emotions, and bodily functions. Over time, the thalamus completely breaks down, and with it, the ability to enter deep sleep. The disease usually appears in midlife between ages 30 and 60, but some cases have occurred earlier. Once it begins, it follows a horrifyingly predictable pattern. Stage 1. The sleeplessness. Begins 0 to 4 months. The person develops mild insomnia. At first it feels like normal sleep trouble, but it gradually worsens. Anxiety and panic attacks appear. The heart rate speeds up, body temperature rises, and the person sweats profusely. Stage 2. Hallucinations and mental breakdown, 5 to 9 months. Sleep becomes nearly impossible. The person begins to hallucinate, seeing things that aren't real. Their memory starts failing, their speech becomes slurred, and they struggle to stay focused. Some begin talking in gibberish, while others become aggressive or paranoid. Stage 3. Complete sleep deprivation and physical decay, 10 to 12 months. At this point, the body is in total collapse. The person is stuck in a zombie-like state, awake but delirious, unable to think clearly or move properly. Muscles start to waste away, and the person experiences uncontrollable tremors and seizures. Stage 4. Coma and death, 12 to 18 months. After months of no real sleep, the body begins to shut down completely. The person falls into a vegetative state, unable to move, speak, or respond. Eventually, they slip into a coma and die, not from exhaustion but from total brain failure. FFI is terrifying because it's not caused by injury, infection, or lifestyle choices. It's genetic, passed down through families. If one parent has the mutated gene, there's a 50% chance their child will inherit it. The disease has been traced back to a handful of families worldwide, most notably in Italy, Spain, and the USA single family can lose multiple generations to the same cruel fate. Scientists have tried everything to help those suffering. Sedatives don't work because FFI isn't just bad insomnia, it's the total destruction of the brain's ability to enter sleep. Inducing comas doesn't help because even in a coma, the brain still fails to rest properly. The only hope lies in prion research, understanding how these deadly proteins function and finding a way to stop them before they destroy the brain. But as of today, there is no cure, no treatment, and no way to prevent the inevitable. Fatal familial insomnia is more than just a disorder. It is a slow, waking death where sleep, the one thing every human being needs to survive, is ripped away forever. Alice in Wonderland Syndrome, a warped perception of reality. Imagine sitting in your room staring at your hands and suddenly they start shrinking. Your fingers become tiny, doll-like, almost disappearing before your eyes. Then, without warning, your entire body stretches, growing impossibly tall. You look around, and the walls seem to breathe, shifting in and out like waves. The objects in the room become huge, towering over you, or microscopic, too small to even recognize. This isn't a dream. This is Alice in Wonderland Syndrome, AIWS, a rare and bizarre neurological condition where a person's sense of size, shape, space, and time completely distorts. People with this syndrome feel as if they are shrinking, micropsia, growing, macropsia, or being stretched in unnatural ways. Some report that the floor feels miles away, while others feel as though they are floating, detached from their own body. Named after Lewis Carroll's famous story, where Alice experiences similar distortions after falling into Wonderland, AIWS can be terrifying. Imagine reaching for a cup and watching your arms stretch like rubber. Imagine looking in the mirror and seeing a version of yourself that is completely disproportionate. But this syndrome isn't just about visual distortions. It can also affect time, sound, and touch. Some people feel that time is moving in slow motion, while others say it speeds up so fast that everything becomes a blur. Sounds may become unbearably loud or so faint they barely exist. Even the sense of touch can be altered. Objects may feel much closer or farther away than they really are. So what causes this bizarre condition? Scientists believe AIWS is linked to abnormal activity in the brain's parietal and occipital lobes, which control spatial awareness and visual processing. The most common triggers include migraines. AIWS is most often seen in people who suffer from severe migraines, sometimes appearing before or during an attack. Epilepsy. Seizures affecting the visual cortex can cause AIWS episodes. Brain infections. Epstein-Barr virus, which causes mononucleosis, has been linked to AIWS in some cases. Psychedelic drugs. Some hallucinogenic drugs like LSD or psilocybin can cause temporary AIWS-like distortions. Head trauma. Concussions and brain injuries have been known to trigger AIWS episodes. Neurological conditions. AIWS can appear in people with multiple sclerosis, strokes, or even dementia. One of the strangest things about AIWS is that it doesn't affect the eyes, only the brain. People experiencing an episode can still see clearly, but their brain processes the information incorrectly, making their environment seem distorted and surreal. For most people, an AIWS episode lasts only a few minutes, but in rare cases, it can go on for hours or even days. Some experience it only once in their lifetime, while others suffer from chronic episodes. There is no specific cure, but treating the underlying cause, like migraines or epilepsy, can help reduce symptoms. AIWS isn't deadly, but it is deeply unsettling. Imagine walking through life never knowing when reality will suddenly morph and distort around you. Imagine looking in the mirror and seeing a version of yourself that doesn't look right, as if you were staring at a reflection from another dimension. For those who live with Alice in Wonderland syndrome, reality is never stable. It warps, bends, and reshapes itself without warning, turning the world into a constantly shifting dreamscape, where nothing can be trusted, not even your own senses.